The global death toll from the coronavirus just hit a staggering number. 2 million lives lost to COVID-19 in just over a year, and that's according to data from Johns Hopkins University. Here in the United States, that death toll now topping 390,000. Public health physician Dr. Pernell joins me now with more. Dr. Pernell, behind those statistics are very real people, and you, I understand, were inspired to take part in the Moderna vaccine trial after losing your father and your cousin to COVID-19. And I'm sorry for your loss, and I really want people to understand just what that means. Behind these numbers are people we know, people we love. Can you tell us a little bit more about your experience?
Sure. I think it's utmost importance to talk about the faces of the pandemic, Morgan, as you were describing. I lost my 78-year-old father on April 13th due to the COVID pandemic. And I also lost my cousin recently, who was an essential worker in Newark, New Jersey, a postal worker. And he had a catastrophic stroke because of COVID-19 complications, as well as my sister being what we call a long hauler. So it's important that when we say that this pandemic has devastated Black and brown communities, that people really have a sense of just how staggering that toll has been. And I can tell you that personal experience, in addition to what I've seen in my role as a public health physician, really was fuel, fire in my belly to get involved, to really help us arrive at a solution. So that's why I volunteered for the COVID-19 vaccine trials.
And you're brave for doing so. I think you talk about Black and brown communities. Speaking personally, I've had lots of conversations with people who are kind of taking a wait and see approach. Blacks and Latinos saying, look, I'm not sure. Given the history in this country, I need some time to see how this vaccination plays out, with people who've had it for a while. What do you say to people who are reticent to get the vaccine?
I hear that every day, and I spend countless hours, but they are worthwhile hours, having conversations with people to help allay those fears and concerns. First and foremost, we have to validate those concerns. We have to meet those concerns with empathy and with science. And then I like to give my personal experience. I found out, I was unblinded, that I actually did receive the vaccine as part of the trial. So I've had my 2 injections of Moderna since October 2nd. And I use my example. I use my example that I haven't had any lingering side effects since those 2 injections, that when I did encounter side effects, they were tolerable and they were short-lived. And I tell people the wait and see approach can truly turn out to be deadly. The mortality rate in Black and Indigenous communities exceeds 1 in 750. The mortality rate in Latino communities is approximately 1 in 1,000. And even for those who don't die from coronavirus, the morbidity, out of a study coming out of China, it showed that those who had been hospitalized because of coronavirus, about 75% had one lingering side effect or one lingering adverse outcome because of the infection. And I can tell you my sister has had that experience. So it's not worth those cumulative risks. It's not worth it. And I say it's better to have a listen to the science, have a listen to the data, and to consider what's truly at risk.
I really hope people heard what you said, that wait and see approach can be deadly. And speaking of that Moderna trial, Moderna is planning to give people who participated in that trial a booster shot to test the need for follow-up shots. So can you explain medically why that booster might be necessary?
So this is exactly what we want the science to be doing, evolving. So what we know to date, we know that 2 injections at both Moderna and Pfizer have studied, that those injections need to be followed to see how long that immunity lasts. We know that the immunity probably lasts for about 90 days, and that's really about natural immunity. What this study will help us to understand is what is the immunity afforded by vaccination? Being able to give people an additional dose 1 year later, because that's what Moderna is going to do, we'll be able to say, hey, this is a type of vaccine that we'll have to receive on an annual basis, or this is a vaccine that's going to have long-standing immunity. And we need to have that level of a definite and clear answer so that we actually lock down the pandemic. I use that expression expressly because we don't want to be in a situation where the pandemic comes back because we haven't appropriately protected people for the amount of time.
And doctor, let's talk briefly about the treatments. NBC News is reporting that monoclonal antibody treatments for COVID are going largely unused, and that's mainly because of lack of time, resources, awareness. So what do viewers need to know about this treatment? And frankly, what do our viewers need to know about how they can get it?
I was just doing a town hall where I referenced this the other day in Newark, New Jersey. I had a person in community reach out to me who had been seen in an urgent care facility, a Black woman, approximately in her late 50s. And the doctor there told her, okay, you're not severe enough to be hospitalized. Go home, isolate for the 14 days, and follow up if your symptoms worsen or get more severe. But I knew that she would be a candidate for the monoclonal antibody therapy. So what people need to know that if you are above a certain age, if you're 55 or older, if you have certain risk factors, if you have high blood pressure, if you have COPD, if you have diabetes, if you have what we classify as morbid obesity, if your BMI is equivalent to or above 35, you need to be evaluated for monoclonal antibody therapy to see if it's appropriate for you. Because when it is used, it typically shortens the duration of the symptoms that you experience, and it shortens the severity of those symptoms.
And doctor, just before I let you go, the CDC is warning the highly contagious UK strain of COVID that we've all been talking about could become the dominant strain here by March. So aside from social distancing and, of course, mask wearing, are there any other safety tips you have for our viewers?
Get vaccinated. I can't put it more or clearly than that. Those public health measures that you described are our baseline, our foundational measures, right? Even if you are vaccinated, continue to wear your mask, continue to do frequent hand hygiene, and continue to physical distance. Please avoid large events, especially indoor crowded events. Avoid those things that increase your risk. Other than that, we on the public health side, we need to continue to do surveillance. So testing of the genomes of these different variants that come up to ensure that we understand what's happening.
Dr. Pernell, thanks so much for your courage. Thank you so much for your clarity and your messaging. We really appreciate your time.
Thank you, Morgan.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.